Hello and welcome. You're watching News 9 Digital. I'm Pratibha. Thank you for joining me live today. As we know, several vaccines are in various stages across the world. We're all waiting for vaccines to come out because that would be the best defense against coronavirus. But even as trials are going on, there are several stages that these vaccines are in, some even a little more controversial than the other. In fact, now the United Kingdom has backed a controversial proposal that says that for the vaccine trials, a few healthy individuals will be deliberately injected with coronavirus. They will be exposed to the virus, and after that, the vaccine trials will take place. While the purpose of this is to ensure that we get a better understanding of coronavirus, even now, a few months into the virus, we don't know everything about it yet, and that's what makes this pandemic all the more threatening. So if coronavirus is injected deliberately on a few healthy individuals, then the scientists believe that they could know a lot more. This would also give us a better picture on how effective these vaccines are, to know the efficacy of the vaccines as well. But understandably, this has been mired in controversy as well, with several even asking if it's ethical to do something of this sort, because these are healthy individuals. Like in the case of other vaccine trials, of course, these individuals would have volunteered for this project, so they will be well aware of the risks that it carries, and then they have agreed to it as well. But even then, is it right to put such healthy individuals at a risk like this? Is it normal? Is it something that happens with the other vaccine trials as well? To understand more on that, joining us live is Dr. Venkatrao, a professor from the Shiksha Anusandhan in Odisha. Many thanks for joining us, Dr. Venkatrao. This is something that sounds quite scary, frankly, when we look at it, at the outset, that healthy individuals will be injected with coronavirus. They will be exposed to coronavirus at a time when the mortality rate is increasing. The numbers are at least increasing across the world. At a time like this, many might be wondering if this is the kind of risk that we should be taking. Even if it's a minuscule number, should we take the risk of deliberately exposing them to coronavirus?
So the point is, this is nothing but what we call it as human challenge.
Okay.
It's not a new concept, but it has been previously been practiced for other diseases, like cholera or typhoid and all these diseases. They have been tried. But in this case, a personal concern would be like for a new disease where we are not sure about what are the long-term consequences. Should you really go for a human challenge? For example, in India, the Bharat Biotech has tried with an animal challenge.
Right.
Of course, animal health activists have got a concern over this, but nevertheless, they have tried with an animal challenge. Ultimately, what we are targeting. See, when a vaccine comes out, two things we have to look at.
Okay.
Is it safe and is it effective? Now, the safety is assessed through phase 0 of animal experiment, and then phase 1 and 2 you can make out.
Okay.
And then when it comes to the effectiveness, is basically we have to see whether the antibody titer has been generated sufficiently or not.
Okay.
One more step ahead, what they're going ahead is the human challenge, where the virus being exposed to.
Okay.
Not necessarily that is really required at this junction. Because for effectiveness, if a community is being vaccinated, definitely whether they are suffering from a corona after the exposure or not, because the corona transmission, now community transmission is going at a high level. So we can easily find out.
Okay.
For that, you may require a larger sample size, as has been decided in case of other corona vaccine trials in India. But human challenge, I would personally, it's my concern. Rather, should we really go for this kind of thing?
Yes.
Second point is, we do not know, because this is a new virus, how long in a long-term consequences somebody can develop a cardiomyopathy or a kidney disorder because of a long-term consequence of coronavirus. In such a situation, of course, the report says that they will have they would be testing the individual for at least 1 year.
Yes.
But nevertheless, 1 year is maybe too short to comment upon. So this is my concern I have expressed.
Okay, that is quite a concern, because as we've seen in the cases of a few coronavirus patients as well, now more than ever it seems like we need even post-recovery clinics, because even now we know very little about the virus. So clearly, the battle with coronavirus itself, it does not end with that. Even after that, there are people who are suffering with various conditions, especially since the virus is also affecting people in a very different way. So it's very difficult to really predict. But would you also say that on another hand, when we think about it, at a time when the entire world is suffering, such extreme measures might be needed, because several researchers have spoken of, whereas in the other vaccine trials, we are waiting for the probability of somebody being infected with coronavirus. This will make these trials much faster. So even if this is a risk, as of now they've zeroed in on 90 individuals, but even otherwise there are people, the numbers across the globe are much more. So that's the reason why such a step needs to be taken. Would that be something that's considered? Would you say that this again boils down to the ethics of whether it would be right or not? Or, talking from the medical fraternity, would you say it's the need of the hour really, because of the numbers that are increasing across the globe?
See, there are 3 points. Number one, this particular study is yet to get the ethical approval. That is the first point. Second point is for faster, the timeline, what you said. Now, the timeline, you are not going to gain much because of this human challenge.
Okay.
Because ultimately, whether you do a routine testing, where the phase 1, phase 2, 3 trials, or this way, you are not gaining much of your time. And the third point would be about the effectiveness. There are other methods of in vivo methods, like in the laboratory, you can go for a neutralization assay rather than subjecting a human being for a human challenge test.
Okay.
This would be my opinion.
Okay, so, if human trials, you're saying that the effect might not be so different as is the case with the other vaccine trials as well. Is there a reason why, even the UK is backing such a plan? Because you're saying that it's not going to speeden up the process as well, because that would be one of the factors why it could be considered as well. So what are the factors that really go in to ensure that people are also backing it in the hope that we get vaccines real soon?
That's really, till now it's not very clear what exactly they might be there in their minds. But nevertheless, let's suppose we take a small sample of subjects, 18 to 30 years they have chosen. So in that small sample of subjects, if it is corona challenge test is positive, successful, do you mean to say that in the people who are having comorbid conditions or different age groups or the vulnerable groups like old age people or pregnant ladies or children, is it safe? Can you predict it?
Yeah.
So the question still remains unanswered. So in such a situation, again, my comment would be, is it really needed?
Okay, absolutely. All right. Dr. Venkatrao, many thanks for joining us with your thoughts on that. This is quite a controversial plan, but the UK has backed it as well in the hope that the vaccine trial would be speeded up. They begin in January. If it gets the ethical committee approval, it will begin in January, and they hope to have the results by May. But yet again, there are several questions that come up. Firstly, healthy individuals being exposed to coronavirus at a time when there are increasing cases across the globe. Would it be right? Would it be ethical or not, even if the individuals themselves are volunteering for it? And like the doctor just told us as well, these are healthy individuals who are going to be exposed to coronavirus. So even then, there would be questions on the efficacy of the vaccines on those with comorbid conditions, a few more in the vulnerable section as well. And that's the reason why this, of course, runs into controversy time and again. In the next few days, it will be clear whether UK backs it completely or not, and whether it's going to begin or not. We'll keep you posted on that. But that's all I have for you today in this video. Thank you so much for watching. Please like, share and subscribe to News9 Digital. I'll see you in the next video. Take care.